The Children's Justice Center is helping kids all over Utah.
Its efforts are often unseen, but the results last a lifetime. And here to talk about it is Dr. Antoinette Lasky, professor of pediatrics at the University of Utah. Good morning.
Good morning.
Let's start with, just so our viewers are up to speed, tell us a little bit about the Children's Justice Center so everyone understands what it is and what it does.
Sure. The Children's Justice Center is Utah's answer to providing the best care to patients who've experienced probably one of the worst traumas that they could have. We provide mental health, medical, and comprehensive care for patients in their communities in a very specialized way that's meant to address the things that have happened to them in a very trauma-sensitive way.
Okay, so in your opinion, how does it help? How does the CJCs work with kids and help with long-term problems, psychological problems, abuse, those kinds of things?
What we know about children who've experienced child abuse is that it's the beginning of a long journey that requires a lot of specialized care and people that are working together to make sure that things are going as smoothly as possible for them. So we know that when children and families have had this happen, if we work together using the best evidence that we have available to us, we can set them on a journey to healing so that this isn't the defining moment of their life. It just is a really bad part of their life.
So is it actually possible to minimize the long-term effects?
Oh,
what
absolutely.
You're talking about? Mm-hmm.
Yeah, one of the things that our Children's Justice Center does is provide comprehensive wraparound services that include things like victim advocacy, medical care that's focused on a child and provided by people that specialize in the care of children. And then most importantly, it's the mental health services that are available that are evidence-based and focused on addressing trauma that children and families have experienced.
Okay, so how's the CJC working with Primary Children's right now to help out?
Oh, one of the things that I'm really proud of with our program is that we have statewide reach, and Primary Children's provides the medical services for the programs around the entire state. So all of the providers that work in our Children's Justice Centers are specially trained, and we all work together under the umbrella of Primary Children's.
Okay, so tell us then about the Shine campaign and how that plays into all of this.
So the Shine campaign is really an important effort that we've put together, focusing on what happens after the abuse has happened. So it's not looking at this moment in time, it's looking at the future and the hope that exists when you have the right services after this thing has happened to you.
Well, I mean, it seems like a no-brainer that somebody would want the CJC to help with somebody that they love. But if you've got a caregiver that's a little bit concerned, a little bit nervous about taking a child to the CJC, what advice would you give to them?
I would tell them that the thing that makes the CJC unique, particularly in the communities that we serve, is that you have a facility and a group of people who commit their lives to caring for children, and who understand that this thing that's happened to them is something that needs a specialized training and expertise to handle. So while it's scary, the people that you're going to be meeting with are there to help you on this journey so that you can begin the healing process.
Dr. Lasky, thanks so much for talking with us. Very good information and just another resource that's out there that people may not be aware of. Thank you.
And very good work.
Thank you for having me.